Recorded Books and RB Digital present Memory Rescue, Supercharge Your Brain, Reverse Memory Loss, and Remember What Matters Most by Daniel G. Amen, M.D. Narrated by L.J. Ganser. The Problem, the Promise, the Program. The Problem. Memory problems are common at every stage of life, and they can impair learning, working, relationships, and even self-reliance. Memory problems clearly get worse as we age, with 75% of older adults complaining about them. No problem is more closely associated with memory loss than Alzheimer's disease, AD, one of the most feared and devastating illnesses of all. With the aging population, experts expect the incidence of AD to triple in the next 30 years, and there is no cure on the horizon. The Centers for Disease Control and Prevention report that the U.S. death rate from AD rose by 55% between 1999 and 2014. If you live until age 85, you have a nearly 50% chance of being diagnosed with AD or another form of dementia, and these illnesses start in the brain decades before any symptoms appear. The Promise. Your brain's history is not its destiny. Even if you have brain fog or trouble remembering now, it doesn't mean you always will. You can start having a better memory today by engaging in the Amen Clinic's simple memory rescue, Bright Minds program. What's more, the same plan will help your energy, mood, anxiety, sleep, weight, and overall success in life. The plan will also help you decrease your risk of developing Alzheimer's disease and other forms of dementia. Scientists have estimated that delaying the onset of AD by as little as 1 year could reduce the number of cases worldwide by as many as 9,200,000 by 2050. Of course, we must do much better than that. And you can and will. The Program. Memory Rescue is based on an insanely simple idea. The best way to sharpen your memory, reverse brain aging, and prevent AD is to eliminate, prevent, or treat all of the risk factors that steal your mind, represented by the mnemonic, a memory device, Bright Minds. B. Blood flow. Hypertension or prehypertension, stroke, cardiovascular disease, cholesterol problems, erectile dysfunction, infrequent exercise, less than twice a week. R. Retirement, aging. Risk increases with age, over 50. Lack of new learning. When you stop learning, your brain starts dying. I. Inflammation. Gum disease, high homocysteine or C-reactive protein, CRP, levels in your blood. Low omega-3 fatty acids. G. Genetics. A family member with Alzheimer's disease, any other form of dementia, or Parkinson's disease, having the E4 version of the APOE gene. H. Head trauma. A history of head injuries with or without loss of consciousness, playing contact sports, even without a concussion. T. Toxins. Alcohol or drug abuse, exposure to toxins in the environment, mold, pollution, or personal products, cancer, chemotherapy, etc. M. Mental health, chronic stress, depression, attention deficit disorder, attention deficit hyperactivity disorder, post-traumatic stress disorder, bipolar disorder, schizophrenia. I. Immunity, infection issues, chronic fatigue syndrome, autoimmune issues such as rheumatoid arthritis or multiple sclerosis, untreated infections such as Lyme disease, syphilis, or herpes. N. Neurohormone deficiencies. Low levels of thyroid, testosterone, males and females, estrogen and progesterone, females, DHEA, dehydroepiandrosterone, high cortisol levels. D. Diabesity, diabetes, prediabetes, and obesity. S. Sleep issues, chronic insomnia, and sleep apnea. The good news
Sample complete. Ready to continue?